And I'm going to try to share my screen. Can you all see this? And can you still hear me? Okay, this is a good start. So this is the Department of Medical Laboratory Sciences, and I'm just going to kind of give you an overview at first, and then at the end we'll talk about how to fill out the application and how to get admitted to the program. So if you're just looking for information, you can get off anytime you like or stay on to watch that as well. So anyway, who are we? Basically, that's one of our problems, is we are the hidden profession. We used to be called medical technologists. Then we changed our name to clinical laboratory scientists. And today we're medical laboratory scientists. So all of those letters pretty much mean the same thing. We are the people who perform the scientific tests on any specimen, biologically, any fluid that you can produce, we can do a test on. We use sophisticated lab equipment and different techniques. We consider ourselves the doctor's doctor. And 70% of medical diagnoses and treatments are based upon this laboratory testing. We also consider ourselves a vital member of the healthcare team. And I do have some videos. We'll see if they work. Wish me luck here. If it has a commercial, I apologize. Hopefully it's appropriate.
Diane, if it's playing, we can't see it.
I can't see it?
You may have to stop share and then share again.
Oh,
the
okay.
other.
Stop joint damage and will make lower your ability to fight infections.
How about that?
Serious, sometimes fatal events, including infections, tuberculosis, lymphoma,
We lost
other
part of the
cancers,
commercial.
nervous system and blood disorders, and allergic reactions have occurred. Tell your doctor if you've been someplace where fungal infections are common, or if you're prone to infections, have cuts or sores, have had hepatitis B, have been treated for heart failure, or if you have persistent fever, bruising, bleeding, or paleness. Don't start Enbrel if you have an infection like the flu. Enbrel.
All right, welcome back. Well, as we do every Jobs Friday, we're bringing you a look at areas of the economy where help is wanted right now. Where are the jobs? Well, Kate Rogers joining us now with a look at the hidden profession that might just be saving lives. Kate.
Hi, Brian. Good morning and happy Friday. In the midst of this global pandemic, the need for medical laboratory scientists and technicians has really come to the forefront as the need for accurate and quick COVID-19 testing is really in high demand. Now, these scientists, they're often hidden behind biohazard doors. They're not working face-to-face with patients. They're conducting laboratory tests in hospitals and public health labs. And like other professionals in the healthcare industry, there's a need for many more scientists with a vacancy rate that's as high as 46% nationwide. The role is key for effective treatment. Some even call them the doctor's doctor.
I know other areas like nursing and physicians have their challenges, but without laboratory testing, physicians start guessing, or, they're doing their best empirical types of diagnoses. And that works in some cases when you're looking at signs and symptoms and other things. But ultimately, you need a laboratory confirmed test to basically prove that someone has a COVID infection or they have an antibiotic resistant infection or anything else. Otherwise, you start mistreating, or you may even misdiagnose.
Now, beyond just COVID-19 testing, these professionals are also running tests on all kinds of other diseases, from diabetes to heart disease, et cetera. Brian, just because we're in this global pandemic doesn't mean people aren't getting sick with other illnesses. So they're putting more strain on an already strained system during this all-important time. Back over to you.
All right, so if somebody's watching this and said, I want to do that as a career, do they need a college degree? If so, what kind? What kind of education might you need for this?
So there's a tiered system in terms of how much experience that you might need. You could go get a 2-year degree and then get a certification called an MLT. You can also get a 4-year bachelor's degree. And we even spoke to one scientist who had her PhD working in a public health lab. So there are all different types of steps rather, and you can go in and get certified again and again and continue to grow your career.
Okay,
Is there
so
any way to analyze the overall
Oops.
markets and not all the things that are happening with the trade war and the protests in Hong Kong?
Well, I actually did spend much of my
Looks
life
like I
in
need to
China,
close it
about
out.
10 years
I
before,
learned that right now live on. This is called
learning this system. So, okay, we'll share the screen again. Everybody okay? All right, let's move on. I had another video, but I think that it's too hard to show. And this recruitment video is on our website at wichita.edu/MLS if you'd like to see it. Basically, it goes through the different departments. But I think that that CNBC video was really good as far as accuracy and exactly what we do. I did also want to introduce you to our faculty and staff at Wichita State. I'm the chair, and I also teach hematology. Lori Alloway teaches our chemistry and urinalysis in our management classes. Retha Dieter is our blood banker. Sarah Nickel is our microbiologist and also our molecular diagnostics expert. We'll have her talk a little bit more about that later. Noelle Steen assists me with my hematology. She does my hematology labs, and she's also our clinical coordinator. And then Susie Jackus is our academic program specialist, and she only works half-time, so she is not on this video call. So this is our mission statement. Basically, in a nutshell, we're going to try to educate resourceful, adaptable, and well-prepared individuals to lead the medical laboratory profession. We also want to help contribute to the body of knowledge for the medical laboratory sciences. And we want to also facilitate lifelong learning for the medical laboratory scientist. These are the different disciplines within the profession. So if you work in a hospital lab, these are your choices. Mainly it's hematology and hemostasis, chemistry urinalysis, microbiology, immunohematology, which is also known as blood bank, and our molecular diagnostics / immunology. So this next slide tells you a little bit about what I do, the hematology and hemostasis. We spend probably, I would say probably 90% of our time looking at blood smears to try to diagnose different leukemias and anemias. And we have an extensive slide set. Over here on the right is a picture of a blood smear, and you can notice that there's lots of monotony. So we pretty much know that this person has a leukemia. We would do further testing then to find out what type of leukemia that patient would have. So we help make the diagnosis. And so if we make the right call, then the physician makes the right treatment for that patient. Also in hematology, we do what's called hemostasis, where we're seeing how long it takes your blood to clot with different testing devices. This picture down at the bottom is a very old testing device. I like to show it because if you ever see something like this, we do still use them. It's a semi-automated. What you see in hospitals is going to be very, very automated. So, but if you see one of these, and I'm not talking on eBay, okay? I'm talking like if you're ever in a hospital lab and you see one of these, or if you go to their storage room and you see one, hey, I want that. It's nice to have more because I know that the ones that I have are probably going to break any day now. And Lori, I'm going to let you talk about chemistry and explain exactly what a chemistry person does in the hospital lab.
Okay. Well, what we do, we measure various chemicals. So basically your different body systems produce different chemicals and we can measure them. And we do that because we are trying to determine a person's level of health or perhaps we're trying to assist a physician in screening or diagnosing for, a specific medical condition or a disease. So some examples of things that we're covering currently in chemistry right now include the liver. So we're talking about, one, how the body system normally functions and then chemicals that are produced normally in that individual when they're healthy. And then we talk about enzymes and biomarkers that are associated with different medical conditions and diseases. And so we discuss those things in lecture, and then in lab, we test some of the things, the same type of things that they would do in a clinic setting or in a hospital setting. So we can do biomarkers to test for hepatitis B or hepatitis C, or we can do liver enzymes to determine if someone may have cirrhosis, for example. And then we're in class now, we're getting ready to start the cardiac chapter. And in that section, we can talk about some of the cardiac biomarkers that someone would have elevations in. So if they show up at the ER, for instance, and they're having a heart attack, so there's cardiac biomarkers associated with that. Our testing gives the physicians the information they need to treat that patient. And then we also can measure lipids as well, because that determines someone's risk for coronary artery disease, for example. So those are just a couple of the sections. But yeah, we can measure the glucose levels to determine the types of diabetes. We can measure therapeutic drugs, and then also drugs of abuse. So really we can test any chemical that is produced by any body system, and it can be in blood, it can be in urine, it can be in cerebral spinal fluid, joint fluids. So chemistry it's a pretty broad subject, and we break it down in class by going through each body system individually. It's great fun.
Okay, thank you, Lori.
You're welcome.
Next is blood bank. Retha, are you on? No. Oh, Retha's not on. She's having TDs. Okay, immunohematology is also called blood bank, and basically it is an area where they cross-match blood to find compatible units. Hey, Retha, do you want to come over here? Sure. She's right next door. We'll put on our masks so that we are socially distancing and being careful. She's on her way here.
I can hear you.
Oh, okay.
Okay, sorry. I'm not sure what's going on with my laptop. Anyway, immunohematology or blood bank is where we get blood ready for transfusion. And while that sounds very simple, it really isn't, because sometimes people have problems with what we call antibodies to their blood cells. And if we don't get a match for those antibodies, we can cause some real harm to a patient. So basically, we are the people that provide safe blood transfusions. There are different ways that we can do it. The old school way is in tube, but we also have some automation that we rely on. So that is blood bank probably in a nutshell.
Thank you, Retha. Moving on. And incidentally, some of the pictures that we have here are actual students from the past. So now microbiology, Sarah Nickel.
Yeah, so microbiology, most of you have probably already had like a regular micro class. So we're going to do kind of similar things, but basically in microbiology and MLS, we're going to be focused strictly on things that cause human infections. And that's anywhere from bacteria to viruses to molds to parasites. We're going to grow the different things. We're going to look at how they look on a microscope. We're going to be able to tell what's growing on the plate by how it looks. And then we can do biochemical testing and actually figure out the exact species of something. We can also look at it as far as its protein structure and figure out what it is. We get to do lots of really cool things in micro. And I sometimes feel a little guilty because people think micro is so much fun, but all of the MLS parts are very fun. It's just we get to see color changes and cool things growing. So that makes people get excited. But we do have a lot of fun in micro. And then that kind of ties into molecular. So I teach both of these sections because they're very related. So the reason molecular diagnostics really came to be was because of viruses. Viruses take forever to grow. You can grow them, you have to have a cell. And I'll get to teach you a little bit about that. But if we want to look for them quickly, we actually need to look for their genetic structure. So we're going to look at either their RNA or their DNA, and that's what we use molecular diagnostic testing for. Now, my background in it is primarily infectious disease, but we can also use molecular testing to look at things like genetic abnormalities. If people have something like a factor V Leiden mutation, we can use it to look for cancer in patients. So there's lots of things we can do with molecular, but basically it's just an overall terms saying we're looking at basically DNA, RNA.
Thank you, Sarah.
Yeah.
Incidentally, both Sarah and Lori are graduates of the MLS program, so they know what they're talking about. All right, so now we have some frequently asked questions. And number one question is, what can I do with a degree in MLS? There's a lot of things that you can do. Most of our graduates work in hospital labs, but you can also work in a physician office lab. You can work in reference labs. You can even get into research and even public health labs. You could get into genetic and molecular testing, medical and pharmaceutical sales, and even some of the instruments that we use, you could be into sales for that and help with setting up different instruments and pharmaceutical research. Right now with COVID, you could get into helping with creating the vaccine. Food services, some of our grads have gone into food services, not recently, but we have people who do quality control on different food sources. I know we had one graduate who went to Golden, Colorado, and is doing quality control on Coors. Who knows? You can also get into assisted reproductive services and help infertile couples. Get into forensic investigation and help with DNA analysis of crime scene specimens. And if you like computers, our labs have a LIS system, so you can get involved in creating different software programs or creating a system for a lab. Or you could do what we do. You can get into education and get into teaching. I never thought that I would want to teach, but now I can't imagine doing anything else. We also tell people that it is a really good stepping stone for other medical degrees. For example, you can get into, use it to get into med school, pharmacy school, dental school, pathology assistant, and we even have a doctorate in clinical laboratory sciences, which you could get at KU now. So there's lots of different avenues that you can take with this degree. It's very versatile, and you can do a lot with it. What are the career advancement opportunities in the field? Well, in the hospital lab, you either are bench tech, you can go into being a lab supervisor, you could be the manager over the entire lab, or even get into a lab director position. Most lab director positions are pathologists, but there are some labs that would include someone who has an advanced degree in medical laboratory scientist. You can also specialize in different areas. You can specialize in heme, blood bank, immunology, molecular biology, chemistry, micro. There's also master's degrees. We don't have one here, but there's master's, and as I mentioned before, there's also a doctorate degree in MLS. With the doctorate, what you would do is you would be the liaison between the lab and the physician, kind of like what a pathologist does now. But instead of, looking at tissue and stuff like that, you would be probably coming up with new tests, also helping the physician know what tests to order for certain disease states, that type of thing. And it's actually become very popular at KU. They have 10 people coming into that program next year. Then I get this a lot also. What's the difference between an MLS and an MLT? Well, an MLS is a bachelor's degree, and an MLT is an associate degree. The MLT performs routine lab tests just like an MLS does, but they're typically automated and require they do require sophisticated equipment, whereas the MLS does the same thing, but they also are involved in more complex and may require manual preparation. And usually the MLS is going to be supervising the MLT. But a degree in MLT is also very worthwhile. It usually takes around 2 years, and there's programs in Barton County, there's a program in Liberal, and there's also a program in Manhattan. And once you have your MLT, we also have an MLT to MLS bridge program that you could get into. How many years does it take to attain an MLS degree? Well, the bachelor's at Wichita State is 120 credit hours. 68 of those are general education courses, and then 52 hours are what you would get in the professional program. It usually takes a student around 3 years to get the prerequisites before they come into our program. Our program then is 17 months in length. 12 months you will spend with us here at the university doing lectures and student labs. And then you'll spend approximately 5 months of your time at a clinical practicum site. And if you started, say, this September at 2020, you would finish December 2021. We do take students in the fall and the spring. The deadline for fall admissions is April 1st, and the deadline for spring admissions is November 1st. So that deadline is coming up, and we try to stick to that deadline. And if we fill our class within that time, then we will stick to it. But if there's extenuating circumstances, we can extend that deadline a little bit. We did have to do it last spring because COVID hit. What are the prerequisite courses? Well, they're Biology 1, Chemistry 1 and 2, Anatomy and Physiology, and there's several offerings at Wichita State that you could take. The microbiology, we require 220, but you could also take 330. The biochemistry, we teach a MLS 311, or you could take chemistry 661. And then medical immunology or immunobiology will also work. And in order to be eligible, you have to have a C or greater on all of those courses. Where will I do my clinical rotations? There's a lot of different places. We have 25 active clinical sites. Most of them are in Kansas. We have all of Wichita, which includes Wesley and St. Francis, or Via Christi system, and West Wichita, and then the Robert Dole VA Hospital. We have Hutchinson, both the hospital and the clinic. We have El Dorado, Newton, Salina, Lawrence. I guess you all can read this. But we also have sites in Kansas City now. And we have sites in Oklahoma. We have Tulsa. And we have now 2 sites in Topeka to do your clinical rotation. There aren't enough sites to put everybody in Wichita with your class. So we tell people not to get a lease on their apartment because they may have to go out of town for their clinical rotation. I get this also a lot. How much money will I make per year? Well, it just depends. According to the government, the Bureau of Labor Statistics, the median salary is $53,880. Now you have to remember that's a median. That's not starting salary. Currently in Wichita, if you're just starting, they make between $43,000 and $48,000 a year, and that may or may not include differential or holiday pay. So it's a decent salary, and you have to remember it's entry level. We've had students go to both coasts, the East and West Coast, and we recently sent out a survey to find out how these students feel that they were prepared once they got out of the program, and we found out that they were making on both coasts around $65,000 a year. But you have to remember that the cost of living is a little different on the coast, so that's why probably they're making a little bit more money than we are here in Wichita. The estimated job growth until 2024 is about 13%. And we're in great demand right now. And I think COVID is only going to help increase your chances of finding a job. And because it's really opening a lot of doors. Plus, it's opening up the fact that people now know, gosh, the people that do the lab tests are not the physician. They are actually different people that do these things. And then how do I apply to the program? I'm going to click on this. And I guess you probably can't see that, right? Sarah, can you see that?
No, you'll have to stop your share and then, yeah, I hate that about Zoom.
How about this?
Yeah.
Yep.
Okay. So this is our website. And if you go into this section, you'll find a section that says Bachelor's of Science in Medical Laboratory Sciences. If you click on that, then at the bottom over here, it has program details. Are you still all seeing this?
Yes.
Okay. And then there's a guide to admission. And what I'm going to do, this is giving you the deadlines. You can see that we extended it to May 1st back for the spring semester, for the fall semester. And then there is an online application. The problem with this, when you click on this, it wants you to complete it, because once you click get into it, you'll have to submit it. You can't really save it. And so we get a lot of applications that are only partially filled. So I want you to see an actual application. Still seeing it?
Yes.
And I tried to work through this to see if I could go to the next screen, and it will not let you unless you fill out your email address. So you have to answer the preferred email address. I'm just going to put my stuff in there so I can see my own application. So basically it wants your contact information, your demographics, and then you click on next. And then it wants information on your high school, your date of graduation. So what I'm trying to tell you here is you need this information available when you go into this. So make sure you're prepared, because once you hit, you don't actually, there's no submit. If you close the window, it submits. So, and then it wants to know all the places that you have attended as far as higher education, whether or not you're applying for full-time or part-time, which semester, and whether or not you'll have your general education courses complete when you, or if you're doing it now. You have to have them complete before you enter the program. And then it tells you to list the ones that you're still working on. And then it wants to know a little bit about your work experience. We use this to determine whether or not you've got experience leading a team, or that you've experienced working for someone, and we know that you have some professionalism there. And then we want 3 references. So it's a good idea to have these people in mind. And we will have a link that you will send. This is the link that you'll send to your references. And what we really like you to have is a biology and chemistry reference, and then a personal reference. We know sometimes it's really difficult to get references from chemistry and biology professors. You cannot use us. That would be a conflict of interest. So if you're taking immunology or biochem right now, we can't be a reference for you, because we're teaching you right now, and we're also on the committee that chooses these people. So try to find someone that's a good source, and sometimes that's hard. But if you have any question, you can always call us, and we'll tell you whether or not that would be an acceptable reference. For a personal reference, it can't be your family member. That's definitely not someone we would like as a reference. It could be your pastor, it could be like an employer, that type of thing. Also, we don't want your best friend. So we like to have a very candid reference from your personal reference. And then you're going to write, it can't be more than 948 characters. including spaces. Really, what is your rationale for wanting to do this? We want to know, do you know what you're getting yourself into? Do you understand what it's like to be a medical laboratory scientist? And that's very subjective as far as how we rate that, but we want to know, do you know what you're getting yourself into? And do you know what this person's going to be doing when you get out? And then we also want you to know that you have to have these essential functions in order to be in the program, and they're very basic: vision, you have to have communication skills, you have to have be able to move freely from one location or another. You also have to have fine motor skills. And you just acknowledge that you have these things. And then an emotional stability. You also have to acknowledge that you're going to have a background check, and also acknowledge that you're going to be working with blood and body fluids. You'd be surprised how many people don't realize that. And then also acknowledge that you're going to need insurance during the time you're in the program. And then this very last one's kind of important. As a medical laboratory sciences student, I understand that prior to entering into the clinical rotation phase of the program, I must obtain liability insurance. Documentation of liability insurance will be kept on file. Right now, the college pays for your liability insurance when you go into clinical rotations. And that's basically it. Notice I clicked and it says you're 100% done, but I don't see a submit button. So once you get here, it's going to auto submit, and then we will send you an email within 72 hours saying that we received it. If it's not complete, we'll let you know so that you can resubmit it again. But you have to start from the beginning, which is kind of a bad deal. Does anybody have any questions about the application process? If so, you need to unmute yourself. Any reactions?
I have a question about how long it takes our references to fill out their portion.
Would you like to see that part?
Yeah.
I can do that again. Oh.
Diana, you'll have to stop screen share and share again.
Thank you.
Yep.
They need to fix that.
They do. I hate it.
Okay, there we go. Okay, here is the link for online references, and this will automatically submit a reference. I'm just going to put my own name in here. It's too long. And then it'll be who the reference is will be next. And then how they know the applicant, how long they've known the applicant, and the site at which you know the applicant. And then here are the things they're going to be evaluating you on: your intellectual ability, your degree of motivation, your reliability, your cooperation in a school or working environment. Now, they may not know all of these, so if they don't know, they can choose no chance to observe. Your acceptance of constructive criticism, your emotional stability, your honesty and integrity, your initiative, your ability to listen and follow directions, and your manual dexterity. Some of those I may not know, and that's okay. But then here's what they would choose. They can highly recommend, recommend with reservation, or do not recommend. And then there's a space for comments. And a lot of people will write a separate letter and send it in as well, but they could write a letter and cut and paste it into this comment box. Okay, are we back? Okay. So good to have someone who's checking on me. Okay, so this is the admission criteria. This is how we decide whether or not you get into the program. And overall, you have to have a minimum of 50 points in order to qualify for admission. So everybody's given points based on this criteria. So your grade point average gives you the most points. So if you have a 4.0, this gives you 40 points automatically. If you have a 2.5, this gives you 25 points. And the minimum GPA to be eligible for admission is 2.5. And then you also have to have a 2.0 on all the prerequisite coursework. So 40 points or up to 40 points for your GPA. Then your references, you can get a maximum of 15 points for your references. So for each highly recommend, you get 5 points. For each recommend, you get 4 points. And for each recommend with reservation, you get 2 points. And if they don't recommend, basically you get 0 points. And if they don't recommend, that holds a lot of weight for us. And then the application form also has a portion where you give your work experience. So we want evidence of knowledge of healthcare. If you work or volunteer in the medical lab, you automatically get 6 points. If you work or volunteer in healthcare or patient care other than the medical lab, you automatically get 4 points. If you work anywhere, you get some points. Evidence of ability to lead or participate in diverse teams. Again, if you work anywhere and you were a leader, that's team participation. If you were like class president or a class officer while you were at the university or at your college, that's also worth points. And then your narrative that you write for us shows us your evidence of knowledge of the profession and application presentation. So if you have no idea, but you write really a good letter as far as grammar and spelling, that's 2 points right there. So all over together, I think you have a possibility of getting like 86 points if you have a 4.0 GPA. But again, remember, you only need 50 points in order to be considered eligible for admission. And then this last slide, I'll leave up for a little bit, but basically these are different websites that you can get into. The first one is ours that can give you more information about the program. And then there's a really good website called Lab Testing Matters that will have usually case studies in it talking about the laboratory. There's also our national organization, ASCP and ASCLS. And then there's Lab Testing Online. If you want to know information about a certain lab test, this is a really good resource to tell you what it is and how to interpret any results that you may get. Okay. All right, so that's really all I have right now. I'm going to give the floor to our students. We do have 3 students in the gallery here. We have Angel, and we have Natalie, and we have Sarah. So I don't know who wants to go first. If you want to put up number 1 that you will go first, just unmute yourself and you can get started.
I can go first. My name's Angel. I'm a first semester student. I can give you a brief summary of like my experience as a first semester student. I could tell you that Dr. Cochran and Lori are amazing professors. They all want you to pass this program. So they're not people that try to trick you or, you know, because if we look good, then they look good. So, but Natalie, I can let you go next.
Hi, I'm Natalie. I'm also a first semester student. Dr. Cochran and Lori are honestly the best teachers. They really do want you to succeed. And like, basically anytime their doors open, you can go and ask a question. And the application process was super easy for me, but definitely make sure you have that stuff ready. And yeah, Lucero, I'll let you go.
So basically, piggybacking off of what they said, they really allow for an environment where you can fail and still do good in your class, it's really important that you don't be too hard to yourself if something bad happens, because that's just part of the process and that only makes you better. So all the teachers are really good at giving that type of environment to us and helping us improve.
Does anyone have any questions for our students? Because they're ready for them. You want to kind of give them an idea of what a typical day looks like?
Oh,
You can go, Angel.
all right. Well, it's a Monday through Thursday deal. Mondays and Wednesdays are lecture days, so we start at 8 o'clock and end class at 3-ish. And in the mornings we have chemistry, clinical chemistry from 8 to 11. Then we have a lunch period from 11 to 12. And then 12 to 3 we have clinical hematology, and that's on Mondays and Wednesdays for the fall semester. Tuesdays and Thursdays are labs, and it's broken up into three lab groups, starting from 8 to 10, 10:30 to 12:30, and then 1:30 to 3:30, which I believe is new this year because of COVID. So they're broke up the lab groups. So we have smaller lab groups. So there's actually more of a chance to do one-on-ones and with the lab instructors and just the professors in general. So it's kind of a neat deal. I've heard anyways. So Natalie, do you have anything or Lucille to add on to that?
I think, sorry, I think one of the main concerns people probably have for the following semester is about COVID. Just to let everybody know, we are all within 6 feet of each other. We're all taking the necessary precautions. We're wearing masks. If you have any questions, they're willing to answer as well. So everything is good.
One thing to add is with the lab groups, with the 3 different lab sections. So you either have the 2 morning labs and you're out early, which I think would be nice. You come in late for the 2 later lab sections, or you do what I do and have a 3-hour gap, but that gives you a lot of time to study, which is always needed.
One thing I'd like to add, something that I actually underestimated a little bit about how much of information or how much homework or tests we're gonna have. So I actually was working full time when I got into the program, and I was thinking I could possibly handle it. So I had to end up reducing my hours quite a bit because it's just a lot of information that you get. Not trying to scare anybody away, but it's a lot of information you get, a lot of tests and quizzes each week. Well, not a lot of tests. I guess Lori's class is 13 tests through the whole semester, and hematology is 5 exams this semester. But we have quizzes, so in between. So you want to study every day and not procrastinate, because if you don't get something, you like the next lecture, you get a pile of information during lecture, and it just keeps piling up. So you want to keep up every day. Just don't underestimate the program is what I'm trying to say. Anybody else have something to add?
Yeah, definitely don't underestimate it. I definitely don't want to scare you away, because it is a lot of fun and they're always willing to help. But don't underestimate it. But you can still work and do the program. Like, I work 15 hours a week and I can still manage it okay. But it definitely is something that you have to tackle daily.
I actually, on the other hand, don't work. I actually quit my job because I was like, I like to procrastinate a little. I like to take breaks. So knowing myself, I kind of just took off, and it's helped me a bit. But if you're really good at time management, you could probably handle a job as well.
Very good. I see that Noelle is in the house. Hey, Noelle. Noelle teaches my hematology labs.
Hello.
And all of our instructors are excellent in this program. We don't have anyone who's a bad teacher. So you're going to get the best education possible in this program. Does anyone have any questions for me or our students or any of the other faculty?
I had a question. So I know for like some doctors, they can like sign a contract to work somewhere for like a certain amount of time and they'll like pay back your loans and stuff. Is that an option in this profession?
Absolutely. Yeah. Occasionally we'll have, especially the rural areas, they'll pay for your tuition and fees, that type of thing. And usually it's a 2 or 3 year commitment to work in that facility. So yeah, it's definitely a possibility.
And then like for shadowing, is that like, is there any like specific places that you recommend in Wichita for shadowing?
That's a tough one. We used to be able to do that, but because of HIPAA, most places will not allow shadowing. We do have a couple of faculty who do work at the hospital, and occasionally they can sneak you in. But I don't know what the new policies are on that, especially with COVID. Do either one of you, Sarah or Noelle, know anything about whether they would accept shadowing at this point?
I was gonna say it's almost easiest to go between Noelle or myself because we both do work at the hospital. But with COVID, I haven't been able to bring anyone in during all of this. So I don't know about Noelle. Have you tried to do that?
No, I haven't since all this started. So my guess is they would be a little reluctant right now.
We can always show you our student lab, but trust me, it's not the same thing. But we can kind of give you an idea of what lab has in it by our student lab, but we're not the real thing. Any other questions?
I had a question. So once we do apply and everything, do we need to like notify our reference people in order to like get on the website and do that?
When you apply, there's a link that you can send to your references.
Okay, so that should show them.
Mm-hmm.
Okay. And I also was wondering if pathophysiology was needed or not.
It's not required unless you're an MLT, then we do require it. We have an MLT to MLS bridge and it is required for them. It doesn't hurt to have that course.
Okay.
It's not required.
I'd like to add on to the reference thing. I know when I was applying, I had my references in mind already. And I remember my first two references got turned in the reference form right away. And then my third reference had told me that they were going to do it and they were going to do it and ended up not until I got an email from at the MLS program and saying that my third reference was still needed. So I don't know, just have that extra fourth or fifth reference in mind just in case. So you're not last minute asking somebody else, to fill out reference forms. So it's always good to have those extra references just in case the third one doesn't follow through. So yeah.
Thanks, Angel. That's really good advice because that happens and, they don't have to, even though you've asked them, they don't have to do it. So, and we need those 3 references. Without them, then you wouldn't be considered eligible. So we will let you know if it gets close to the deadline. If we're missing something, we'll let you know so that you can start bugging those people again. Because we don't want that to be the reason, because that's out of your control. We don't want that to be the reason that you don't get in the program. Any other questions? Anything I've left out, faculty?
I have a quick question.
Okay.
For next fall, when can you start applying the application process?
You can start now if you like, but the deadline is April 1st.
Okay, thank you.
Mm-hmm. That's terrific. Please apply. All right, well, I don't have anything else. And so I just want to thank you all for attending our first virtual. I think this is probably something we need to continue, but I really still like to meet in person and show you around our facilities. So thank you all for being here, and I guess take care and have a good weekend.